The 10 amlodipine side effects your doctor is praying you don't discover. What if I told you that one of the most trusted blood pressure medications prescribed to over 40 million Americans carries hidden consequences that rarely make it into those brief office conversations? Picture this. You're handed a prescription, told it will protect your heart, and sent on your way with barely a mention of what might actually happen to your body. Amlodipine sits quietly in medicine cabinets across the nation, taken faithfully by patients who believe they know exactly what they're putting into their bodies. It's become so routine, so commonplace, that the conversation around its effects has been reduced to a simple narrative. Lower your blood pressure, protect your heart, live longer. But what happens when we pull back the curtain on the complete picture? Here's what most people don't realize. Every medication powerful enough to fundamentally alter how your cardiovascular system functions will inevitably create ripple effects throughout your body. These aren't just theoretical possibilities buried in medical journals. They're real experiences happening to real people every single day. The question isn't whether these effects exist, but rather why the full conversation about them seems to get abbreviated in clinical settings. Today, we're going to explore the comprehensive landscape of what amlodipine can actually do to your body, drawing from clinical research and documented patient experiences. This isn't about fear-mongering or discouraging necessary treatment. This is about ensuring you have access complete information you deserve when making decisions about your health. Let's start with side effect number 1, peripheral edema and fluid retention. When you take amlodipine, you're essentially telling your blood vessels to relax and widen. This vasodilation is precisely why the medication works so effectively for blood pressure control. However, this same mechanism creates an unintended consequence that affects a significant portion of users. As your blood vessels dilate, the pressure dynamics within your circulatory system shift. The smaller vessels, particularly those in your extremities, can begin to leak fluid into surrounding tissues. This fluid accumulation most your ankles and commonly manifests as swelling in feet, though it can extend up into your lower legs. Clinical studies reveal that this swelling affects approximately 7 to 10% of people taking amlodipine, with the likelihood increasing substantially at higher doses. What's particularly interesting is the gender disparity here. Women are nearly twice as likely to experience this fluid retention compared to men taking the same dosage. The swelling typically develops gradually, over weeks or months, which means many people don't initially connect it to their medication. They might notice their shoes feeling tighter, socks leaving deeper impressions, or a general puffiness that seems to worsen throughout the day. The fluid retention follows gravity, so it's almost always most noticeable in the evening and tends to improve somewhat after a night's rest with elevated legs. Side effect number 2 takes us into more concerning territory: the development of gingival hyperplasia or gum overgrowth. This particular effect catches most people completely off guard because it seems entirely unrelated to a blood pressure medication. Amlodipine belongs to a class of drugs called calcium channel blockers, and these medications can interfere with calcium regulation in various tissues throughout your body, including your gums. When this happens, your gum tissue can begin to grow excessively, creating thick, puffy areas that can eventually cover portions of your teeth. The process usually begins subtly. You might notice your gums looking slightly more prominent or feeling different when you brush your teeth. Over time, this can progress to significant overgrowth that affects your ability to eat comfortably and maintain proper oral hygiene. The overgrown tissue can trap food particles and bacteria, leading to additional complications like infections or persistent bad breath. Research indicates that somewhere between 1 and 3% of amlodipine users develop clinically significant gum overgrowth. The risk appears to be higher in people who already have some degree of gum disease or poor oral hygiene, suggesting that existing inflammation might accelerate the process. Moving to side effect number 3, photosensitivity reactions and increased sun sensitivity. This is one of those effects that can completely blindside people, especially those who spend time outdoors or live in sunny climates. Amlodipine can make your skin dramatically more sensitive to ultraviolet radiation. This doesn't just mean you'll burn more easily, though that's certainly part of it. The medication can trigger abnormal skin reactions, even with minimal sun exposure that would normally be completely harmless. These reactions can range from severe sunburns that develop after just minutes of sun exposure to more complex skin changes like hyperpigmentation or even blistering. Some people develop what looks almost like an allergic reaction, with red, itchy patches appearing on sun-exposed areas of skin. The mechanism behind this isn't entirely clear, but it appears to involve how amlodipine affects cellular responses to UV radiation. Your skin cells essentially become less capable of protecting themselves from sun damage, making even brief exposures potentially problematic. Side effect number 4 brings us to a cluster of neurological symptoms that can significantly impact daily functioning: dizziness, lightheadedness, and balance issues. While many people expect some dizziness when starting a blood pressure medication, the effects of amlodipine can be more persistent and complex than anticipated. The dizziness associated with amlodipine isn't just about blood pressure dropping too low, though that certainly plays a role. The medication affects calcium channels throughout your nervous system, including areas responsible for balance and spatial orientation. This can create a sensation of unsteadiness that persists even when your blood pressure readings look perfectly normal. Many people describe feeling like they're walking on a boat or experiencing a subtle spinning sensation, particularly when moving their head quickly or changing positions. This can be especially problematic for older adults, where balance issues significantly increase the risk of falls and injuries. The fifth side effect we need to discuss is something that often gets overlooked in initial consultations: sexual dysfunction and decreased libido. Blood pressure medications as a category are known to potentially affect sexual function, but amlodipine presents some unique challenges in this area. The medication's effects on blood vessel function can interfere with normal sexual response in both men and women. For men, this might manifest as difficulty achieving or maintaining erections. For women, it can mean decreased arousal or difficulty reaching climax. Both sexes might experience a general reduction in sexual interest or desire. What makes this particularly frustrating is that these effects can develop gradually over months of treatment, making the connection to the medication less obvious. Many people assume these changes are due to aging, stress, or relationship issues, never considering that their blood pressure medication might be a contributing factor. The psychological impact of sexual dysfunction can be substantial, potentially affecting relationships, self-esteem, and overall quality of life. Yet this side effect rarely gets adequate discussion time during medical appointments, leaving many people to suffer in silence or discontinue their medication without proper medical guidance. These first 5 side effects represent just the beginning of our comprehensive exploration into amlodipine's complete effect profile. Each of these reactions stems from the medication's fundamental mechanism of action, but manifests in ways that extend far beyond simple blood pressure reduction. What's becoming clear is that when we introduce a medication powerful enough to alter cardiovascular function, we're inevitably affecting multiple body systems simultaneously. The challenge lies in recognizing these connections and understanding how they might impact your individual experience with the medication. What's particularly concerning about these effects is how they interact with each other, creating a cascade of symptoms that can be difficult to trace back to a single source. The person experiencing ankle swelling might also be dealing with sun sensitivity, while someone struggling with balance issues could simultaneously be facing intimate relationship challenges. This interconnected web of effects rarely gets discussed as a unified picture. Side effect number 6, ventures into territory that most patients never see coming: cognitive changes and mental fog. While the brain might seem disconnected from a blood pressure medication, amlodipine's influence on calcium channels extends throughout your nervous system, including areas responsible for memory, concentration, and mental clarity. People taking amlodipine sometimes report feeling like they're thinking through a haze. Simple tasks that once required minimal effort suddenly demand more concentration. Names become harder to recall, conversations feel more difficult to follow, and that sharp mental edge seems dulled. The research on this particular effect shows interesting patterns. Older adults appear more susceptible to these cognitive changes, but younger people aren't immune. The effects can be subtle enough that many people adapt to them gradually, accepting reduced mental sharpness as a normal part of aging rather than recognizing it as a medication side effect. What makes this particularly troubling is how it can impact professional performance, driving ability, and general life satisfaction. When your thinking feels clouded, every aspect of daily functioning becomes more challenging. Moving to side effect number 7, gastrointestinal disruption and digestive changes. The calcium channel blocking action of amlodipine doesn't limit itself to blood vessels. Calcium plays crucial roles throughout your digestive system, and interfering with these processes can create a range of uncomfortable symptoms. Some people develop persistent nausea that seems to have no obvious cause. Others experience changes in bowel habits, ranging from constipation to loose stools. Stomach pain, acid reflux, and general digestive discomfort can emerge weeks or months after starting the medication. These digestive issues often get attributed to dietary changes, stress, or other medications, making the connection to amlodipine easy to miss. The symptoms can be particularly pronounced when taking the medication on an empty stomach, though eating doesn't eliminate them entirely for everyone. The 8th side effect brings us to something that can profoundly impact sleep and overall well-being: vivid dreams and sleep disturbances. Amlodipine's effects on calcium channels extend to areas of the brain involved in sleep regulation, potentially altering both sleep quality and dream patterns. Many people report experiencing unusually intense, vivid dreams that can be disturbing or exhausting. Some describe feeling like they've been awake all night due to the intensity of their dream experiences, even when they've technically gotten adequate sleep time. Sleep architecture can also change, with alterations in deep sleep phases and REM cycles. This can leave people feeling unrefreshed upon waking, despite spending sufficient time in bed. The cumulative effect of disrupted sleep can impact mood, cognitive function, and overall health in ways that extend far beyond the immediate sleep issues. Side effect number 9 addresses something that can be both physically uncomfortable and emotionally distressing: hair loss and changes in hair texture. While not everyone experiences this effect, those who do often find it particularly upsetting because it's visible and can affect self-image. The hair loss associated with amlodipine typically presents as diffuse thinning rather than distinct bald patches. Hair may become noticeably thinner, more brittle, or change in texture. Some people notice increased hair in their brush or shower drain, while others see a gradual reduction in overall hair volume. The mechanism appears to involve how calcium channel blocking affects hair follicles and the growth cycle of hair. The changes can be gradual enough that people don't initially connect them to their medication, often attributing hair loss to aging, stress, or hormonal changes. What's particularly frustrating is that this side effect can take months to develop and may continue for some time even after discontinuing the medication, as hair growth cycles are naturally slow to respond to changes. Finally, we reach side effect number 10, temperature regulation problems and unusual sensitivity to heat or cold. This lesser-known effect can significantly impact comfort and daily activities. Yet, it rarely gets mentioned in standard medication counseling. Amlodipine's influence on blood vessel function can disrupt your body's normal temperature regulation mechanisms. Some people find themselves feeling unusually cold, particularly in their hands and feet, even in moderate temperatures. Others experience the opposite problem, feeling overheated or having difficulty cooling down in situations where they previously felt comfortable. This temperature dysregulation can affect sleep quality, exercise tolerance, and general comfort throughout the day. People might find themselves constantly adjusting clothing, avoiding certain environments, or feeling uncomfortable in temperature ranges that never bothered them before. The effect appears to be related to how altered blood vessel function impacts heat distribution throughout the body. When your circulatory system's response to temperature changes is modified by medication, your normal adaptation mechanisms can become less effective. These 10 side effects represent a comprehensive look at how amlodipine can impact various body systems beyond its intended cardiovascular effects. What emerges from this exploration is a clear picture of how medications designed to target one specific function inevitably create broader physiological changes. The key insight here isn't that amlodipine is dangerous or should be avoided. Rather, it's that truly informed medical decision-making requires understanding the complete scope of potential effects, not just the primary therapeutic benefit. When you know what to watch for, you can make more informed choices about your treatment and communicate more effectively with your healthcare providers about your individual experience. Now that we've examined these 10 comprehensive side effects, what becomes unmistakably clear is that amlodipine's influence extends far beyond the simple blood pressure reduction that dominates most medical conversations. From swollen ankles to cognitive fog, from gum overgrowth to temperature sensitivity, this medication touches virtually every system in your body. The real question isn't whether these effects are worth experiencing. That's a deeply personal decision that only you and your healthcare provider can make together. The question is whether you're making that decision with complete information. Too often, the conversation stops at cardiovascular benefits without exploring the full landscape of what living with this medication actually means. Knowledge is power, especially when it comes to your health. Understanding these potential effects allows you to monitor your own experience more effectively, communicate more precisely with your medical team, and make truly informed decisions about your treatment path. You deserve to know not just what amlodipine can do for your blood pressure, but what it might do to every other aspect of your daily life. Remember, this information is meant to educate, not to replace professional medical guidance. If you're experiencing any of these effects, don't suffer in silence or make medication changes on your own. Have an honest conversation with your healthcare provider about your complete experience with amlodipine.